When did you join Doctorpreneur Academy?
I told you I'm a Mind Valley student. I'm always on the lookout for anything which will help me in my personal growth. So I have joined a lot of things, and in Doctorpreneur Society, when I found that your motto is to educate doctors to become entrepreneurs, I thought that's a very good initiative. It is very, very much needed in this time.
Hello and welcome once again to another episode of Hall of Fame interviews. We have with us today Dr. Jyoti Mary, and she is a gynecologist, and she is main area of interest in obstetrics. She has done her graduation and post-graduation from the Calicut Medical College, and she is right now teaching a lot of doctors online and doing a very nice training program. And welcome, ma'am. Thank you for sparing time with us, and congratulations on a Hall of Fame.
Thank you. Thank you, sir.
So let us start from the beginning.
Yeah.
When you're in school or something, you always wanted to become a doctor?
No, actually, no. I wanted to become a housewife because my mother was a housewife.
Okay.
And
That's interesting.
actually, when I was doing my +2, like pre-degree, at that time, all my friends were going for the entrance class coaching.
Okay.
So my father was a scientist working with the IARI, Indian Agricultural Research Institute. So he got transferred to Kerala from Delhi in 80. And since then, he's been working in Kerala under different institutes. And so because he was a scientist and because his office was near to me, I thought I want to join his office so that I can stay with him.
Okay.
So I thought I'll write agriculture entrance exam and get into agriculture. So that's how I started studying for the entrance exam. But when the results came, I had got for MBBS. And so all of my friends and my father's friends, everybody said, why should she take agriculture when she has got into MBBS? So let her go for MBBS like that. So that's how I went for MBBS. I had no idea about all this. And my father told me to take BDS first. He said that you can pluck a few teeth and stay at home and look after your home also, because I love to be a housewife also.
Great.
But then I didn't want to put my hands into somebody else's mouths. So I chose MBBS, but I never knew that I would have to do all these things now.
Right.
Being a gynecologist. After my MBBS, I actually got married when I was doing my third year MBBS.
Okay.
And then I had my first child after my house surgency. And after I wrote my entrance exam for the PG, I wanted MD dermatology.
Okay.
But in Calicut, where I was staying, I could get only DGO.
Okay.
I couldn't get MD dermatology. I could get only dermatology DVD, diploma. So my husband said, if you take diploma, and then his house is in Thrissur. So he said, if you come to Thrissur with diploma in dermatology, you will have to sit idle. You won't get any work. So if you want to work, you should take DGO. So that is how I came to take DGO. I didn't like gynecology at all at the time. I hated it actually. But now I love it. I really love my work because it's very satisfying.
Yeah. If you get a new baby, is going to see the world, and
that is very satisfying. And working with women is really great.
Great journey. This is one of the ladies who is wanting to be a housewife and becomes a doctor and then a professional. Great. So tell me about your training. How do you do? What is the training module you have created, and how did you start that?
Training of what?
Online training.
Online training.
Courses.
Coaching. That's what I said that during COVID time, because I couldn't take physical classes for my patients, I started taking them online. At first, it was Zoom meetings. Then I found that Zoom meetings, I could accommodate only a few. So there were mostly 200 to 300 patients at the time coming for the classes, because they couldn't meet me personally also very frequently as we used to do in the pre-COVID era. So they all wanted to attend the classes, and I couldn't accommodate so many of them in Google Meet and Zoom because I didn't have a paid version then. So then my son told me that you do YouTube live. That is how I started YouTube live videos. At first, I was very reluctant. I was very, I didn't make them public. I made it, after the class was over, I used to make it private only.
Right.
1 year after that, what happened is my channel, somehow some videos came into my channel somehow. I didn't know how. And my channel got taken down. It was taken down. So all the videos I did in that 1 year was lost. Actually, I had started being paid for YouTube at that time.
Okay.
I had got my 4,000 hours and all.
Yeah.
At that time, but now my channel was taken down and I had to start from scratch again.
Okay.
Now, actually, I'm not doing that frequently because I'm more busy now after COVID. But still, I'm taking maybe one class per month live video, and sometimes I take via Zoom also. So the advantage I feel is when I used to take physical classes, I used to do the same topic again and again. I used to get bored with that because the patients will be different. I'll be taking the same topic. So it was very boring. But now I have all those classes on the YouTube. I can take more and more newer topics. And my patients can also listen to the older topics and the newer topics. So new patients coming in can listen to all of my 50 videos which are out there. And so I can send them a video every week or so till their pregnancy journey is over. From the first time they meet me, I send them videos in the community. I make them into communities, like 2 months EDC, patients who have their delivery dates in 2 months. For example, in April and May, I make them into a group. So what video is relevant to them at that point of time, I send to them via my WhatsApp community. So that they get to see all the videos rotatingly, and whatever is relevant to them at that stage is sent to them.
Right, very good.
And the whole, my success actually, it largely depends on fact that I made a team, a very good team.
Okay.
That team consists of mainly 2 people. One was a doctor who I met 12 years back. She was with me all these 12 years. And so though I am a single doctor, I'm working as a single doctor with the help of that doctor. She's working in another hospital also. But I am a single gynecologist in my hospital. So, you know, when it is very difficult to, I have to take duty all the 365 days, every 24 hours. So when I have to take an online class, I have to have somebody to look after my patients. If there is a patient in labor,
right,
there should be somebody. So that my friend was there all through this. She was a great team with me. And then I have a physician assistant. That too I have since 12 years, I'm having a regular assistant in my OP who sits with me throughout the OP, takes the history for me and does all these things like adding people into the community, sending them classes. All these things are done by her.
Right.
So that is how I could do all this. Otherwise, it would be very difficult.
Are you aware that we are having this app? And
I have subscribed to that also. I have already got the app.
Okay, that is good.
But I'm just learning how to do all the things on the app. I'm not
It will be a very, very powerful tool. You'll be able to manage your community.
Yeah, I know.
Unlimited Zoom also.
I have subscribed to Mind Valley. You know about Mind Valley, sir? So I am a Mind Valley student since 6 years. I've been subscribing to them and I'm learning from them, and they have helped me a lot in my personal journey.
Okay. Great.
So from there itself, I had this idea of building courses and all, but I had no idea how to sell them or what to do with them. So now I've got the platform from you. So I'm very grateful.
Yeah. And there will be no looking back. Actually, it is like an asset you create over a period of time. More and more community members are there, and then it becomes a self-sufficient and self-motivating family.
Yeah.
So what have been your learnings in your whole practice? How should we start a practice and how should you run it?
Yeah, what I feel is very important is the gynec patients, especially in menopausal ladies, don't have the proper treatment now. I understood that I'm 54 now, 54 years old now. Okay. When I reached menopausal age, I found it very difficult. I had all sorts of symptoms. It was really terrible going through that. That is when I started to read more about menopause and all. And I found that many people are now endorsing HRT. There was a big study which came out in 2002, WHI study, which I'm not sure if you are aware of it. The Women's Health Initiative study in 2002, which came out, and the results of the study showed that there was an increase in breast cancer risk in people on HRT. And that time I was doing my PG, and since then we have never seen prescriptions for hormone replacement in menopausal women.
Okay.
So we were not trained in that. But now enough evidence is that HRT is safe. There is enough evidence that this is safe. And the Western countries, there are a lot of patients taking it, and there are a lot of doctors speaking on it. But in India, even now in our society meetings and in our conferences, nobody is saying that we should give hormone replacement. It's not talked about as much as it should. Because I have started hormone replacement, I found it has a very good effect on you. On all parameters, it makes your life very comfortable. So I want to do a lot more in that area.
There's a lot of confusion in the market.
Yeah, I want to do a lot of education in that area, both doctors and the second area I'm very much interested is in the microbiome. The microbiome has gained a lot of importance after the microbiome project was over in 2019. I've been reading out about it since about 14 years now, because in 2010, I gave a talk on fetal origin of adult disease. At that time, I was not aware of the term microbiome and the term epigenetics. All these were new to me. And at that time, when I read about these things, it catched my interest. And since then, I have been learning about it a lot. And I have put up a few videos on that for doctors in my channel, which was recorded. But it took a lot of time and energy and effort. So with 4 videos, I stopped. But I want to do it more once I learn how the techniques. And I'm using Canva for all the editing.
For the audience, please can you explain what is microbiome like? What is it? So
the microbiome is the community of bacteria, viruses, fungi, all these microorganisms that live within our bodies. There are about 1.3 times more bacteria, viruses, etc. than our own human cells. So we have 30 trillion human cells, and there are 39 trillion bacterial and viral and all these microorganisms together in our body.
Right.
And these microorganisms play a very big role on keeping us healthy or leading us to disease, whatever it is, depending on how you live your lives. Everything from our diet, exercise, sleep, circadian rhythms, and your relationships and your thoughts, your emotions, stress, all these things affect the microbiome and in turn affect your health. So I am very much interested in that also.
What are the types of lectures you have taken in those 50 lectures, which you take for those patients? What is the topic you normally cover?
For pregnant patients and for PCOD patients also, I take some classes. For pregnant patients, from diet, exercise, stress, sleep, childhood trauma, how it affects our future life, and stress in pregnancy or stress during life, and postpartum care, postpartum depression, different topics, whatever topics I feel that they need. When I meet patients and they talk to me, all of them give me different ideas about what I should teach them. So that is how I get my topics.
So do you think that your online presence has helped you offline also? Yes,
of course. Very much. Very much. I feel that after COVID, I have got a lot more, I get a lot more connection with my patient. They feel connected to me because they are seeing me every week. Almost, they are seeing me in these 50. See, when you meet patients physically, you see them only for a few minutes. Maybe 5, maybe 10, maximum 15 minutes. But when you take a class for 1 hour, they are seeing you for 1 hour and they feel that connection with us. Right. So that has helped me a lot to connect with patients, and with most of the patients, their families also watch these videos. So we are educating the whole family actually. Their mothers and grandmothers, all they all come and tell me, Madam, we are watching your videos also. Good. It has really helped, right? Yeah, it has. Then ultrasound in pregnancy, all the unforeseen complications that can occur during delivery, all these things we can educate. And that helps me a lot because I have already told them that you can expect all these complications. Sometimes it comes only once in a while. But then when such a thing happens, when you talk to them, they are already aware that this is a fact that can happen to anyone. As if they met and seen you before they come. Yeah, before. Yeah. Recognize. You are like a celebrity. Yeah. And not maybe a celebrity in my own small town. Yeah, small. Yeah. I mean, just like we have seen Amitabh Bachchan on TV, but we never seen him. So yeah,
we'll recognize him.
True. They get that connection. Yeah.
When did you join Doctorpreneur Academy?
I told you I'm a Mind Valley student. I'm always on the lookout for anything which will help me in my personal growth. So I have joined a lot of things, and in Doctorpreneur Society, the first time I saw the advertisement, I saw a video, I think, on YouTube.
Yeah.
I thought this is a very good idea because doctors don't have, because I have been talking about this to my colleagues since a very long time. See, you make WhatsApp communities, you do this will help you. But I don't know, people don't understand, or they are not having the time for that. I also tell them that you should have an assistant. Especially those busy doctors, no, they should have an assistant. That is very important,
Very
because
important.
that gives you time to do the other things, which are not, all the paperwork and all can be done by an assistant who is well trained.
Right.
So you don't have to spend all your time on the unnecessary things. You can do things which you really like, and you can learn better.
In fact, yesterday only we were discussing the hourly rate. What is the hour, 1 hour importance for a doctor? So if you start doing the small things which are you can easily delegate, it's not the best use of your time.
Yeah. So when I found that your motto is to educate doctors to become entrepreneurs, I thought that's a very good initiative. It is very much needed in this time.
Because you are one of the doctors, like a gynecologist who is so much interested in IT and digital platforms, and you are contributing also, and you're getting the results also. We want that maximum people should understand that it is not something which is a thing of future. It is a thing of present, and they should embrace technology, and they should get the maximum advantage of it. So many non-doctors are already putting so much of stuff online. It is not relevant, or maybe it is not correct also. So you authentically, doctors should put the content.
Yeah, true. There are so much of nonsense out there. Sometimes when you see some videos, no. Recently, one of my patients went online. She has a channel, and my staff showed me that video. People were asking her so many questions about diet, what to eat, what not to eat, and all. And she was not at all educated. I was thinking, I have put so many videos on my thing. Nobody is asking me.
You can put that question answer videos also.
Pardon me, sir?
You can ask your assistant to ask you the questions that the patient normally asks, and you can answer them.
Yeah.
That will be a very good idea for the short video.
No, I have Q&A sessions.
Okay.
Like once in a month and all, I have Q&A sessions where my patients can join and ask directly live their questions. They can put in the chat box, I answer them.
So how many fan followers are there? How many people are registered?
There are now I have around 2,000 followers.
Very good.
On my channel.
Great. How you are different between other gynecologists, and how do they tell you, like, if you are doing more of digital, so what do they tell to you?
My colleagues, the other doctors.
Contemporaries.
Yeah, they really appreciate. They are always curious to know what I'm doing differently. So I will always tell them this is what I'm doing. But the thing I have to give the message is we have to learn a lot. Our curriculum doesn't cover anything actually. Just by focusing on our curriculum after what we have done, our PG and everything, we actually know very little of everything.
Yeah.
There is a lot more to be learned. And I feel that even more than our regular medical textbooks, there are a lot of books written by doctors out there about different topics.
Right.
For example, Dr. Jason Fung, a nephrologist, he has written 3 books on obesity code, diabetes code, and cancer code. Very good books. He's a nephrologist. And likewise, many doctors, there is a book called Estrogen Matters, written by a gynecologist about why estrogen and how it affects our bodies, and how losing estrogen during our menopause creates all this havoc in our bodies. So all this, these books have given me a lot of insight into many things which I have not learned in my medical college. So I feel that we should go on learning, then only we'll be able to confidently conduct these classes online and all.
To remain updated, and we can remain a lifelong learner. Yeah,
lifelong learner. That is very important.
Great. Thank you for your time, ma'am. It was great talking to you and very inspiring one. Thank you so much.
Thank you, sir.
See you in Goa.
We'll meet in Goa, sir.
Yeah. Thank you.